Hi, I'm Todd Nelson. I'm a naturopath in Colorado who's been serving many thousands of people for the past 34 years. And many of the people I see on a daily basis have blood sugar imbalances, either having prediabetes, where your blood sugar is starting to creep up and stay a little bit high for a long period of time, or diagnosed with diabetes, or another syndrome called metabolic syndrome, which is an imbalance both in blood sugar and cholesterol, possibly with some weight gain and high blood pressure. A little more complex syndrome that may be all coming back to how the heck you're utilizing insulin. So let's talk about blood sugar imbalances. I'm sure you're watching this video because maybe you either suspect that you have some or you've been recently diagnosed. In fact, with prediabetes, which means your blood sugars are just averaging up a little bit, your A1C is climbing a little bit too high, 70% of the adult population of the US has been looked at as having prediabetes, half of which don't even know it. So you may be in that category. Or you may be in the category of actually having diagnosed diabetes, maybe you're on medications, maybe you've tried some different dietary changes, but maybe you're still not getting the control on your glucose and on your A1C as much as you would like to. So let's talk a little bit about blood sugar, because a lot of people these days are looking for natural alternatives. What supplements can I take? What really should I be eating? How much does exercise really affect me? And what else can I do to get a control? And can I actually prevent being on medication or reduce the medications that I'm already on? So let's take a look at this chart for a moment. You've got blood sugar issues, possibly prediabetes, diabetes, or metabolic syndrome. Well, we know that a lot of things play into why you have diabetes to begin with. It could be excess weight, it could be how you've been eating, it even could be tied to genetics, it can run in families, it can be compounded if you're stressed. I don't know if you know it or not, but even being stressed out alters stress hormones in a way that can favor your sugar staying high. Maybe, let's say I've seen some people start to go into diabetes, prediabetes, just being very stressed out and maybe emotionally eating. And that starts to interfere with insulin function and their sugar starts getting on. I've seen other cases, and there's lots of scientific literature on this, about environmental toxicity. Now, most people don't take into account that environmental toxicity can actually start altering pancreas function and start altering the way you uptake and utilize insulin. So when I do an assessment on somebody who comes into the center, I always look at, have you been exposed to things like pesticides, herbicides, or other industrial toxins? That may be playing into the diabetes. And if so, you need some sort of a detoxification program to lessen the burden of toxins, and many times blood sugar control can come back. The other thing is there's a lot of hidden sugars and even artificial sweeteners that can make these blood sugar control issues even worse. For example, high fructose corn syrup, which is in many sodas, of course, and many other foods, is one of the worst sugars you can eat if you have a blood sugar control issue. And artificial sweeteners, even though they're really sweet in your mouth, they don't have any calories, but there's many studies now that show that if you're eating them on a regular basis, it sets you up to crave more sweets. So when you're trying to sift through all this and you're saying, okay, I've got this problem, what do I need to do for me personally? How do I need to eat? What are the best supplements for me? Do I really need these medications in the amount that I'm taking them? Am I toxic? Do I have some underlying toxicity that plays into my problem? Strangely enough, even if you have imbalances in your gut bacteria, that can make your blood sugar worse, and most people don't know that. So as a naturopath practicing functional medicine, my job is to try and find out what's playing into the underlying causal picture for you with your blood sugar. Most of the time you're just going to be slotted into a treatment program that is one size fits all, and that may not fit you. And you may end up not having good glucose control and having to go on stronger and stronger medications, even in spite of your best efforts. And with all sincerity and commitment, you might be seeking natural alternatives. You might say, okay, I got to read up on this on Google, I got to buy some books, I got to start talking to different people, I might need a dietary coach. How do I put this all together for me as a workable program in my life? Well, what the heck is the answer to that? The answer is everybody who has blood sugar control issues needs a highly personalized program. And the reason is, if you don't do that, you may not start gaining function back. Ideally, the time to do that is when you're initially finding the problem. If the A1C is climbing, fasting glucose is climbing, maybe cholesterol is climbing also, maybe weight is climbing, maybe blood sugar is climbing. So you have to monitor those numbers very closely. That's what I do as a naturopath, is to say, what is going on for you? What's the underlying causes? And a lot of products that people just buy sort of randomly based on what they're reading and so forth, ultimately they don't have much science, research, they're not quality controlled, and typically they don't work. So in the realm of functional medicine, we have access to dietary supplements that are highly sophisticated, one of which is studied at the Joslin Center for Diabetes at Harvard, to start help balancing out your glucose on a regular basis and resensitizing your cell membranes to insulin, sort of waking them up, if you will, to take up insulin, to take up sugar, burn it as energy rather than store it as body fat, and to begin to shift that around. And sometimes some people using a program called First Line Therapy, that's the main program I use with people with blood sugar control problems. There's about 3 clinical studies now that show that some people in early stages can shift those numbers into the right direction within 12 weeks, just 3 months of your life. So if you're interested in finding out about this and how a personalized First Line Therapy program might help you, I'm very happy to offer you a free 15-minute consultation with me. You can just enter your name, telephone number, and email address right below this video. My staff will get in touch with you. We'll set up a time. We can either talk by phone or Skype or come into the office and explore if we can maybe get to a little more underlying causes and then really coach you on a lifestyle plan that may help you get to a point of controlling your glucose much more effectively for the long run. I'm really looking forward to meeting you and talking with you. Until then, all the best in health.